The Environmental Health and Wash Research Group at ICDDRB is dedicated to improving public health through cutting-edge research on water, sanitation, hygiene, and environmental exposure. They investigate pathogen transmission, sanitation systems, and innovative interventions to reduce health risks in vulnerable communities. Through evidence-based studies, they aim to inform policies and develop sustainable solutions for a healthier future. In the bustling city of Dhaka, ICDDRB conducted the SaniPath study back in 2017 as part of its commitment to improving urban sanitation and public health. The SaniPath study has already made a significant impact. The study assessed fecal contamination risks across various exposure pathways in urban environments. Through meticulous analysis, the study identified high-risk areas where people were most likely to come into contact with fecal pathogens. Building on this success, we are working to deploy the SaniPath tool at the municipality level, starting with Paikgacha, Khulna. The people of Paikgacha deserve safe sanitation. This is a basic human right. The SaniPath deployment project has already commenced in Paikgacha municipality. The goal is to make sanitation better for everyone. SaniPath is a decision-making supportive tool for better sanitation investment. It helps us to select priority-based sanitation investments. The SaniPath deployment in Paikgacha is a big step forward for the community. We need to understand the specific challenges in Paikgacha. This project will help us find solutions tailored to the community's needs. The SaniPath deployment is a team effort. Experts from different organizations are coming together. The team includes members from ICDDRB, engineers from BUET, a top university in Bangladesh, are also on the team. WaterAid, an organization dedicated to clean water and sanitation, is hosting the project. DPHE, Department of Public Health Engineering, is responsible for planning and maintaining water supply and sanitation systems in urban and rural areas. Makerere University is a key collaborator, contributing expertise in environmental health, sanitation, and public health research. Emory University developed the SaniPath tool and brings extensive expertise in environmental health and microbial risk assessment. The University of North Carolina supports data-driven approaches to assess fecal exposure risks and improve sanitation infrastructure. The Bill and Melinda Gates Foundation provides funding and strategic guidance to improve sanitation and hygiene in urban settings. The Reckitt Global Hygiene Institute is committed to advancing evidence-based hygiene solutions for global health, and they also support this initiative through funding. Each organization brings valuable skills to the project. The SaniPath deployment has clear objectives, such as identifying key fecal exposure pathways and assessing microbial contamination before and after interventions using the SaniPath tool. Evaluate the impact of WaterAid-led wash interventions on diarrhea and fecal bacteria exposure. Strengthen systems by integrating the SaniPath tool into government structures through training and capacity building. The SaniPath deployment involves several activities. The team wanted to understand the sanitation situation in Paikgacha. They traveled to Paikgacha. They met with community members. These meetings were crucial for gathering information. The team also visited different sites in Paikgacha. They looked at sanitation facilities. They studied water sources. The team also studied how people might be exposed to waste. These site visits helped them to select appropriate sampling sites, exposure pathways, and the challenges. The selection of communities was based on key environmental, demographic, and sanitation characteristics. Ward number 1 was selected for its frequent pond use for household activities, high cattle presence, and drainage issues linked to household fecal discharge. Ward number 9, a saline-prone area with tidal fluctuations, relies heavily on rainwater harvesting for drinking. Ward number 4, identified as a densely populated central hub of the municipality, boasts a prominent street food presence. Lastly, Ward number 7 was included due to the presence of a fish market, a minority ethnic community, and drainage challenges. The team selected 5 exposure pathways based on their high potential for fecal contamination and public health risks. Surface water is frequently used for bathing, laundry, and household chores, but contaminated with cattle feces and other pathogens, increasing direct and indirect exposure risks. Drinking water is often harvested from rainwater or obtained from municipal supply and consumed without boiling, leading to a high likelihood of microbial contamination. Raw produce. Items like coriander leaves are commonly eaten unwashed, serving as a direct ingestion pathway for fecal bacteria. Street food. Popular roadside snacks, for example jalmuri, fuchka, are widely consumed, especially by children, in unhygienic conditions, raising contamination risks. Drain water. Children frequently play near open drains, which are directly linked to household fecal lines, increasing exposure to fecal pathogens through skin contact or accidental ingestion. Despite the progress made, the Sanipath deployment faces several key challenges. Limited funding constrains large-scale data collection, community engagement, and long-term monitoring efforts. The lack of laboratory support limits the ability to conduct timely and high-quality microbial analyses. Extreme weather conditions such as flooding, high tides, and seasonal variations pose additional difficulties. Overcoming these challenges is crucial for the success of the Sanipath deployment in Paikgacha. The Sanipath deployment is more than just a project. It is an opportunity to make a real difference. By working closely with the community, the team hopes to create lasting change. There may be challenges along the way. The potential benefits are significant for everyone in Paikgacha. We would like to thank the Promise Consortium, its partners and sponsors for their support throughout the project.